Today we are facing some of the greatest challenges of our lives, from our health to political unrest, the environment, financial uncertainty, and the nation's racial divide. Welcome to Bill Myers Inspires. My idea for this show was to invite guests and get the conversation started, to take a deep dive into the issues that impact our world with an eye to exploring solutions. And we encourage our listeners to look within themselves to take decisive action to make a positive difference.
Welcome to Bill Myers Inspires. I'm your host, Bill Myers, and I am very excited about today's show. I have a very distinguished guest with me who's on a very tight schedule, and so I am very grateful to have him with us. We've got Dr. Woody Myers with us today, and let me tell you a little bit about Woody. An Indianapolis native, Woody is a proud product of the Indianapolis public schools system and a graduate of Shortridge High School. He completed his undergraduate studies at Stanford University and went on to earn his medical degree from Harvard University at age 23 and a Master of Business Administration from Stanford University. Throughout his remarkable career, Woody addressed important problems with every organization he has led, generating real results and leaving each of them stronger and ready for the challenges ahead. Early in his medical career, he worked as an emergency room physician and teacher at the Indiana University School of Medicine. As a young doctor, he saw firsthand the impact that the disparity of income has on health outcomes. Patients with the best health insurance often received the best health care, while others did not, and has spent his career fighting to change that. At the age of 30, Woody was the youngest to serve as Indiana State Health Commissioner and held his appointment under both Democratic Evan Bayh and Republican Governor Bob Orr. As Health Commissioner, Woody effectively led over 2,800 employees, oversaw 5 state institutions, and worked every day to improve maternal and child health, chronic disease control, childhood immunization, and preventative health care services. During his tenure, Woody helped make Indiana a leader in AIDS education and gained national recognition when he fought to keep Ryan White, a teenager with AIDS, in school when his school district banned him following his diagnosis. In addition to being a doctor, Woody is a small business owner who has advised nonprofits and large health care companies on improving their products and services for the benefit of patients. Over his career, Woody served as the medical director for Indiana's largest health care company and as chief health care officer for Ford Motor Company, where he worked with union officials to develop safety programs and high-quality, comprehensive health care benefits. Under Woody's leadership as the chief medical officer at WellPoint, Inc., he led the nation in measuring and improving the quality of health care for workers and their families. As a nationally recognized and accomplished leader in public health, Woody is uniquely qualified to lead Indiana in its fight to improve access to affordable, quality health care and to reduce prescription drug costs. Woody lives in Indianapolis, Indiana with his wife, Stacy. Together, they have 5 children and 2 grandchildren. Please help me welcome today my special guest, Dr. Woodrow Myers. Woody, welcome to the show.
Well, thank you so much. It's a pleasure to be with you this afternoon. Thank you.
Yes, thank you. I do need to mention to everyone, I did not want to give it away at the beginning, but you are the Democratic candidate for the governor of the state of Indiana.
I am indeed.
And,
I declared my candidacy back in July of 2019, and I've been working as a candidate for now almost 14 months, having received the approval of the voters in the primary back in June. And I'm working really hard because we've only got 75 days left before the election.
Yes, indeed. And I am so grateful to your team and your lovely wife for giving me an opportunity to speak with you as quickly as they made that happen. So we're threading the needle. I know you're in between campaign stops right now. So again, I'm very appreciative that you're here with me today. And thanks again to your lovely wife, Stacy. Thank you, Stacy.
Well, she does a great job.
Yes, indeed. So Woody, I wanted to mention that there was a video that your campaign put out just a few days ago, and I happened to see it at about 6 o'clock in the morning. I think it was actually Tuesday morning when I saw it, and it was quite powerful. And the title of the video was "A Broken System," and you shared a number of stories in your experience being a black physician regarding racism. And I want to start there, if you would sort of share with our listeners a few of those stories, because I think that helps set a context for the further discussion that we'll have in just a moment.
Well, I appreciate the reference to that video. The advisors to our campaign interviewed me many months ago, and when I started talking through some of the things that had happened earlier in my career, they made a decision that we should figure out a way to condense those stories in a way that the audience could understand that the racial injustices that so many are now recognizing, in some cases for the first time, have been with us for quite some time. I have experienced them throughout my life in various doses and various situations and geographies, and so what we did in the video was to talk specifically about some that I experienced in medicine. People usually don't think of healthcare in the same context as they do in the criminal justice system. And of course, both in law enforcement and in medicine, the vast majority of people are trying to do the right thing every single day. But even in healthcare, we experience and we have experienced and continue to experience racism. So one of the incidents occurred when I was a medical student and volunteering on the weekends to learn emergency medicine, and I was dealing with a young 14-year-old patient who had been unfortunately out drinking and was inebriated and had a laceration on his scalp, and I was suturing that laceration, sewing it up, and this young man was really pretty sloshed, as we used to say, and was kind of in and out, and he looked up at me as he woke up when I was doing the suturing. And in a very loud voice in a very large room with lots and lots of people, and this was one of the old open wards, used an explicit term that we now refer to as the N-word, and said that term to me and said, "What are you doing to me?" And this is a 14-year-old, and I'm his doctor. And you can imagine the shock in the room when that happened. And you know, there was a part of me that wanted to go out of doctor mode, that wanted to go back into that mode that I had passed on when I was a teenager. But then the doctor of me quickly gained composure, and I stopped suturing him and said, "Well, let's call your father, who I'm sure would love to know that you have been drinking tonight and that you're in the emergency room. And let's have him come down to the ER because you can't be released as a minor. And so whatever he's doing, we're going to stop him and have him come down here and see whether or not I should suture you." And of course, that 14-year-old knew very well that was not the right decision to drag his dad out from wherever he was to come down. And so I continued on. But can you imagine the room that I was in? I was the only African American person in the entire room. I was a medical student and this kid, 14 years old, was saying these things, and as you might imagine, that could be a little unnerving, especially when you're trying to help someone. That was just one of the stories that we told in the video. There was one more. Maybe I'll mention that we had a young 17-year-old. This is now when I'm an intern, who had a disease that's pretty unusual for a kid to have. It was called, and it's a long name, hypertrophic idiopathic cardiomyopathy. And it's basically a weakness of the heart because the muscle in the heart doesn't work well, and so the heart doesn't pump enough blood. And there's really no cure for it. The heart is inflamed, and the only treatment that you can provide that's going to be long-lasting was a heart transplant procedure. Today, heart transplants are performed pretty regularly in a lot of places, but back when I was an intern, they were only being performed at a very, very few spots, and my patient needed one. I presented my patient to the leadership of the hospital, leadership of the cardiology, cardiac surgery service, and I thought, given the fact that he was completely otherwise healthy, he would be a perfect candidate. But they made a decision to not let him have one based upon an assumption that because he was a single parent home and his mother didn't have an extensive education and she was working a couple jobs, that they made an assumption that heart would be wasted on a ghetto kid, and that his mom wasn't going to make the appointments that somehow that heart could go to someone else that could do a better job with it, and they basically denied him a spot, and therefore the young man over time died of his disease. I remember the hurt that I felt that as his doctor I wasn't able to convince the other doctors to do it. I still to this day get angry about the decision that was made, but I was an intern and I obviously couldn't direct the surgery chiefs and cardiology chiefs on what to do. I did protest, but it wasn't accepted. And I look back on that, and I remember how I felt when that decision was made purely on racist assumptions. And Absolutely. That's not uncommon. These kind of things happen far more than people know.
Well, that's why it's important to share that. And like I said, when I saw the video, that particular story really hit me. So I mean, what in the world do you say to the parents? How do you deliver, that notification? How do you look them in the face, knowing what you know from the back room and the decision? I can't imagine.
Let me tell you exactly how that works. It's called being disingenuous, and the way that they handled it was that the cardiologist told the mother, who was very anxious, of course, that didn't necessarily know all of the issues and was worried about whether she was going to be able to afford the surgery in the first place. They said basically, good news, we're going to use medical therapy, not surgical therapy, which to her meant my son is going to be treated with medicines and he doesn't need an operation, and that's going to work. What they didn't point out, of course, was that at that time, the surgical procedure was the only thing that was really going to have any opportunity to save his life. That the medicines were going to lose effectiveness very quickly, and of course they did. And so it's called being disingenuous. They didn't actually lie directly, but they omitted the truth. I remember that like it was yesterday. And it just bothers me to this day that actually happened.
Wow. Well, Woody, that's like I said, it is important to understand that racism exists even in the professional ranks of doctors, lawyers, and the like. It is pervasive problem. And I want to dive a little deeper into that here in just a moment. We're going to take a break right now. You're listening to Bill Myers Inspires with my guest today, Dr. Woody Myers, and we'll be back in just a moment.
Today, we are facing some of the greatest challenges of our lives, from our health to political unrest, the environment, financial uncertainty, and the nation's racial divide. Tune in every Friday at 3 p.m. Eastern Standard Time for Bill Myers Inspires, as he and his guests take a deep dive into the issues that impact our world with an eye to exploring solutions. Emmy Award-winning actor Bill Myers is an accomplished actor, jazz musician, filmmaker, writer, educator, and speaker. As a biracial man who's both black and white, Bill leverages his background, talent, and voice through creativity, compassion, and connection as activism for social justice to focus on uniting the divide and compelling change. Bill Myers Inspires encourages listeners to look within themselves and take decisive action to make a positive difference. For more information, visit his website, BillMyersInspires.com, and sign in for the latest news and updates.
Are you a subject matter expert? Are you here to share your expertise with an audience waiting to hear from you in only the way you can deliver? Are you ready to have your voice amplified across the airwaves? Inspired Choices Network has a global radio platform streaming to millions of people across the world. Professionally produced and supported by an accomplished team every step of the way, you can broadcast from anywhere in the world, knowing your voice matters, and we ensure it is delivered with ease and efficiency. Eager to hear your message, the world awaits. Contact us today to become an Inspired Choices Network radio host. Email becomeahost@inspiredchoicesnetwork.com.
You're listening to Bill Myers Inspires here on the Inspired Choices Network. We're here every Friday at 3 p.m. Eastern Standard Time. Thank you for joining us. And now, let's get back to the conversation.
Welcome back. We are here today with Dr. Woody Myers, the Democratic candidate for the governor of the state of Indiana. And he has taken a brief pause in his campaign schedule to join us today, and I am grateful for that. We were just talking about how racism shows up in the professional sphere of being a doctor or a lawyer. A lot of times we just are not consciously aware of the goings-on and how decisions are made and how many of those are affected by the blight of racism. So we're back. Woody, I was struck by something here recently that about a week ago I came across an article, and I think it was the governor of Michigan, and it was an article about her declaring the state of Michigan, declaring racism as a public health crisis in the state of Michigan, and it went on to, the article went on to share that 19 states, along with numerous cities and counties in America, have declared racism as a public health crisis. And I wanted to discuss that with you because you're a doctor, and I want to know about that. Can you sort of share with the audience so that we can all learn about that? Because they just dropped that information in the news, but it didn't really go into any of the findings or any of the factual data that supports this declaration.
Well, there's a great deal of data now, more so than ever before, that does support the notion that race is a very important factor in healthcare and public health. And so definitely it's a public health. Racism is a definite public health problem in America today. And one of the ways to think about it is the creation of the notion of what we call social determinants of health. If anybody Googles social determinants of health, you'll see lots of different blogs and articles and discussion points about it. Basically, what it says is that if you are poorly educated, if you have lower income, if you don't have good access to information, like you don't have a good internet system in your home, and you're not able to get good news information and information about access to services, or if you don't have healthy food in your neighborhood, if you're living in a food desert, or if you don't have health insurance. These are all social determinants of health, and the absence of any one of those things really affects your ability to both get and receive get good healthcare services and receive good outcomes from those services. And that's what I think generates a number of what we call healthcare disparities.
Okay.
So you might ask the question, for instance, why is it that African Americans have more diabetes or suffer from heart attacks or strokes or, name a different disease? And there are different aspects of those social determinants of health that cause that. And what we're learning in research today in public health especially is that if you correct the social determinants of health, the outcomes will improve. And that's been a relatively recent notion in terms of the public health and the political community accepting that. In the medical community, we've known about it since I was a pre-med student. But nonetheless, today, now it's becoming much more accepted as a political issue. And that's why you're seeing public health departments as being encouraged by their governors, or city health departments being encouraged by their mayors to look at public health, racism as a public health problem.
Wow. I mean, to arrive at that place and the case that you just made, I don't know, maybe I'm oversimplifying it, but it seems to me like it's logical. You know what I mean? If a person doesn't have access to food, they probably got a poor health outcome. If a person does, I don't know about the book knowledge piece, but again, it sort of reminds me of the same thing that happens in the legal system.
Right.
If the person with the purse, wins the case, and so these systems feel sort of bought and paid for. And if you are not a person that has, sort of the proverbial table stakes, you can't even get in the game. You're going to jail. You know what I mean? You're probably going to die. I mean, does that make sense? Well,
it manifests itself in different ways for different diseases. But let me give you a good example. Let's say you've got diabetes. Diabetes means that you need to take in a very good diet, lots of fruits and vegetables. You have to restrict your use of sugar, and you absolutely don't need or want obesity, because that makes the diabetes worse, not better. So if you're living in a food desert, that means that you don't have easy access to fruits and vegetables, and so many African Americans live in the urban core of the city frequently and there's no regular grocery store nearby. So I've seen it myself. Folks go to the local gas station and get food for dinner. What can you buy in a local gas station? You can buy potato chips, you can buy cookies, you can buy salted snacks, you can buy soda pop, and I've literally seen kids being given a few dollars by parents or relatives to go to the gas station to get dinner, and they go and they buy something like I just listed, and they take it home in the little plastic bags. That's what they're eating that night. And for people that have diabetes, it's a surefire way to make the diabetes worse, not better. What you really need are apples and oranges and vegetables and salads and lean meats and protein to make sure that your body is getting the nutrition it needs without the excess of fat and the other toxins that you find in some of these foods. And so it's just a shame that is one of the reasons why we have more deaths in the Black community, especially from diabetic ketoacidosis, which is a complication of diabetes. And of course, people don't think about it a lot, but diabetes causes heart disease. Diabetes accelerates the process by which your arteries in your heart get blocked. And when they get blocked, that's what causes a heart attack, or causes the heart muscle to not be able to pump blood, or causes you to possibly have a stroke. All of these complications of diabetes really hurt us far more than people realize. And diet is a key part of it. So it's just one example of how these social determinants of health actually affect healthcare outcomes.
Wow. That's incredible. I just really needed someone to lay out that case, because just to see the data and the statements without, breaking it down for the average person, I just really felt like I was at a loss in trying to really understand that. Not that it's not valid, but just trying to hear the case that's being made. So I want to jump right now, though, to your run for governor. So you are running for governor. Clearly, you had started your campaign. You said 14 months you've been in the game now. So to look at that clearly preceded any influence of the George Floyd incident, or even the pandemic for that matter. Your candidacy preceded that. And so the question I have for you, Woody, is how has that incident of both the pandemic as well as the Black Lives Matter and the sort of racial bubbling socially and conscious awareness activities, how has that affected your campaign? And has it given it even more purpose and meaning, perhaps? Because both of these things are things that are attached to you. You're a medical doctor. We're talking about a pandemic. We're talking about Black Lives Matter. You're a black man. And I just am very curious if you would let us know how that has affected or played a role in, certainly not in the initial candidacy, because clearly you were there before all of this. But how has that played into your strategy or shored up your...
Sure.
Yeah.
When we first started the campaign, the key issues that we talked about were education, especially K through 12 education, the economy, especially as it affects those at the lower end of the spectrum of jobs and income. We were talking about environmental justice and climate change. Indiana burns a lot of coal, and a lot of pollutants enter the air as a result, and that means that we have higher rates of lung disease as a result of those particulates that are in the air, and then our water gets poisoned by sometimes abandoned factories that leak toxic substances into the groundwater. And in addition, we have an infrastructure that has older pipes in it, and some of those pipes will leach lead into the water, and that's what happened up in East Chicago, Indiana, and they had to close down a whole neighborhood. It was not quite as bad as Flint, Michigan, but was a similar kind of a problem. So all of those are the things that we talked about before COVID and before George Floyd. And now we're talking about those things just as much, if not more today, through the lens of George Floyd, through the lens of COVID-19, because what COVID-19 has done is that it's really exposed the problems in our healthcare system and our public health structure in Indiana even more so because of inadequacies in testing, inadequacies in getting folks treated, inadequacies in how our state organizes around public health. We have seen problems that COVID has caused in our education system. Bill, one of the saddest things the assumption that we made as a state that we could switch from in-person education overnight into virtual education, and you know what happened is that worked okay in a lot of communities where the kids all had their own computers and the kids knew how to use them, and the teachers already had hardware and software in place. and where there was Wi-Fi and broadband and the internet in the home, but then in many of our urban centers like Gary and in parts of Indianapolis and in Muncie and Evansville, Indiana, other places like that, those assumptions are just wrong. And even if there is a computer in the home, then mom or dad's trying to use it to get their job done, and there's 3 or 4 kids that are trying to share it, and no, there's not Wi-Fi in the home. Wi-Fi costs money, and that's not in the budgets of so many, and so education suffered as a result of the changeover to virtual, and that was a result of COVID-19. So COVID-19 exposed those kinds of weaknesses that we have in public health and in education, and many more as well. It exposed the vulnerability, Bill, of our essential workers. Essential worker means that we depend upon you to do something every single day, otherwise our lives don't work. The essential worker has a lot of different categories for it, of course, but most often we mean folks in retail, like in grocery stores, and folks that are providing services as first responders and so on, and folks that produce our food. I mean, those are the folks that are in that category, and many of them are African American and Hispanic people that disproportionately are exposed to the coronavirus in those jobs, and have a result now have a higher rate of infection, and that is a disparity. So what you can see through coronavirus and through George Floyd is just a series of results that were in many respects there before, but now have been exposed even more.
Yeah, well, I mean, it's interesting because when you were just describing the educational disparity with the lower income folks who don't have that computer and that access to Wi-Fi, it's like it's feeding right back in. You know what I mean? To what we started with when you were explaining, that the education of the parents and the access to these things, well, they're not good candidates for good health. You see what I mean? So it's like this vicious cycle for these reasons, and these assumptions that were made, which were wrongly made. Certainly, I used to be a school teacher, and I was at Shortridge when it was a junior high, and I was the theater magnet teacher there, and you cannot make those assumptions that these kids have that kind of level of technology at their fingertips and the sophistication and the economic to support it and pay for the Wi-Fi and everything else. Woody, we're going to take a little break right now, but I'm fascinated by this, and again, I'm grateful that you're here, and we're going to continue this in just a minute. You're listening to Bill Myers Inspires right here on the Inspired Choices Network. Stick with us. We'll be right back.
Today, we are facing some of the greatest challenges of our lives, from our health to political unrest, the environment, financial uncertainty, and the nation's racial divide. Tune in every Friday at 3 p.m. Eastern Standard Time for Bill Myers Inspires, as he and his guests take a deep dive into the issues that impact our world with an eye to exploring solutions. Emmy Award-winning actor Bill Myers is an accomplished actor, jazz musician, filmmaker, writer, educator, and speaker. As a biracial man who's both black and white, Bill leverages his background, talent, and voice through creativity, compassion, and connection as activism for social justice to focus on uniting the divide and compelling change. Bill Myers Inspires encourages listeners to look within themselves and take decisive action to make a positive difference. For more information, visit his website, BillMyersInspires.com, and sign in for the latest news and updates.
You're listening to Bill Myers Inspires here on the Inspired Choices Network. We're here every Friday at 3 p.m. Eastern Standard Time. Thank you for joining us. And now, let's get back to the conversation.
We're back. You're listening to Bill Myers Inspires, and my guest today is Dr. Woody Myers, and we've been talking about racism and its effect in healthcare and and education and so on and so forth. Dr. Myers is the Democratic nominee for governor of the state of Indiana and hub of the universe, by the way. That's where we're coming from. Indianapolis, Indiana, in case you didn't know. So Woody, but before we went to break, we were sort of exploring your concerns, your platform points that you are running on for governor. First of all, are you the first African American to run for governor? I'm
the first one to. I'm the first African American to receive the nomination of this party for governor in Indiana, Bill. And there have only been 3 African American governors in America in the history of our country. Doug Wilder in Virginia, Deval Patrick in Massachusetts, and David Patterson. Although David wasn't elected, he fulfilled a term of another governor, but I would be only the third elected African American to the position of governor in the history of the United States.
Wow. Well, that is certainly a big wow, and I certainly wish you all the best of luck on that, and I'm willing to do whatever we need to do to help you get there. So what challenges are you facing at this time as you look at where your campaign is? What do we have? 2 months left? I mean, we're closing in pretty quick here.
74 days left. The election's on November 3rd. We are dealing with the difficulty that one has when you are going up against, of course, an incumbent candidate. And then it's our campaign activities have been, of course, hampered by COVID-19 because people are not able to gather in ways that we've gathered in the past. And so, for instance, fundraisers typically are events of 10 to 30 people, so everybody gets a chance to speak with the candidate. Typically, you have refreshments and little speeches, and typically people will provide some donations to your campaign. All of those got canceled, of course, in March and April especially. And those were prime time. That was the prime time to raise funds. So clearly fundraising has been affected, not just for our campaign, but for many campaigns around the nation. So we've had to switch to more online efforts, of course, and to make sure that we were able to communicate our message through social media. So we've had to adapt. But, you know, you have to go with the flow. And then, as an ICU doctor, as a critical care medicine physician, you're used to getting surprises. You're used to getting information that's not always positive about your patient. So you've got to react to that information and then move forward. So that's what we've had to do in our campaign. So we're working hard.
Well, it sounds much like a jazz musician. So you don't know. I don't know what this song is, but I'm going to play it anyway. So yeah, that's awesome. So I want to give you a moment right now. If there is a website or contact information that you would like to share with the public, because certainly I want to see to it that you're able to get whatever support that you can get. So I'm going to let you have it for a second, and you can let everybody know where they can go, what they can do to assist you. That would be awesmy.
Well, that's very kind of you. Our website is drwoodymyers.com. It's Dr. Woody is Woody, and Myers is spelled the same way your name is, Bill. Thank goodness, Myers. those MEY people drive you kind of crazy sometimes, don't they?
They do, and we couldn't afford that extra E, so that's just the way I lay it down, man.
So www.drwoodymyers.com is our website. Our social media is at Dr. Woody Myers. Our YouTube is Dr. Woody Myers. Our Instagram, Facebook, Twitter. So if you remember Dr. Woody Myers, you could get to all of our various sources of information and our videos, and you could certainly learn about our campaign policy positions. And hopefully, after taking a look around, that you'll be willing to contribute. We've got, as I said, 74 days to go. We have a lot of things that we want to accomplish in this last 74 days to get our message out. So any help that can be provided, and that's a problem too, Bill. Think about it. I mean, here we are now in an era where we've gone to about 15% unemployment, plus or minus, and then that doesn't really represent the economic challenge that we have in our state and in our nation. A lot of people don't get overtime anymore, had to take salary reductions, went from 3 jobs to 2 jobs or 1 job, and so technically they're employed, but they're not employed like they used to be, and then the people that aren't getting their unemployment checks as a result of what's happening in the White House and in Washington D.C. All of those challenges have made it tougher for the average person to be able to help us. But nonetheless, we're going to keep moving. We're going to not let this COVID-19 or George Floyd reaction or backlash, none of that is going to stop us. We're going to keep working hard every single day. We're going to make our case for racial justice in Indiana through our criminal justice reform plan, our K-12 education plan, our plan to improve health care and to attack the virus, COVID-19 illness in our state. All of those things are on our website. We talk about them every day, and we're going to keep working as hard as we possibly can to make this campaign successful, because I believe Indiana is ready for and needs a change.
That's very exciting, and I agree with you. And I just wanted to take a minute to reflect on your name, Mr. Myers, and my name, Mr. Myers, and the fact that I don't know how many times you've been stopped and asked if you were connected to the other Myers family, but I know that I've logged in plenty of those. It happens all the time, and it's always a point of a good laugh, because I think that the roots of your family and mine, I think both came through Crispus Attucks in about 1932. I think they were in the exact same class. My grandfather and maybe it was perhaps your father or something. I don't know. But yeah,
you're right that my dad was one of the early graduates of Crispus Attucks. In fact, a lot of his brothers and sisters went to Crispus Attucks as well, and back in the old days. And people forget that Crispus Attucks High School was set up by the state of Indiana to segregate students because they didn't want African American students going to other high schools. What they didn't think about was the fact that there would be excellence within this school, and the teachers that were asked to teach the students there were really terrific. All that to say.
Yeah, they were like the best in the country, right?
Yeah, one of the best in the country at the time, of course, and it's still going. It's still going strong. Crispus Attucks is a medical magnet school for the Indianapolis public school system. I went to Shortridge, I believe, like you did, or you worked at Shortridge.
Yeah, I worked at Shortridge, but all my dad and all of my aunts and uncles, they were all at Shortridge when you were there. I mean, they all went to Shortridge. Blue Devils. Yes, indeed. Yeah. So I told Mike Myers, I was telling him that you were going to be on the show today, and he said, make sure you take a moment and address this Myers thing. I said, I absolutely will. So, Woody, we're going to take a brief pause, and we'll come back here in just a moment. You're listening to Bill Myers Inspires right here on the Inspired Choices Network. We'll be right back.
Today, we are facing some of the greatest challenges of our lives, from our health to political unrest, the environment, financial uncertainty, and the nation's racial divide. Tune in every Friday at 3 p.m. Eastern Standard Time for Bill Myers Inspires, as he and his guests take a deep dive into the issues that impact our world with an eye to exploring solutions. Emmy Award-winning actor Bill Myers is an accomplished actor, jazz musician, filmmaker, writer, educator, and speaker. As a biracial man who's both black and white, Bill leverages his background, talent, and voice through creativity, compassion, and connection as activism for social justice to focus on uniting the divide and compelling change. Bill Myers Inspires encourages listeners to look within themselves and take decisive action to make a positive difference. For more information, visit his website, BillMyersInspires.com, and sign in for the latest news and updates.
You're listening to Bill Myers Inspires, here on the Inspired Choices Network. We're here every Friday at 3 p.m. Eastern Standard Time. Thank you for joining us. And now, let's get back to the conversation.
We are back. You are listening to Bill Myers Inspires. I am Bill Myers, your host, and my special guest today is Dr. Woody Myers, Democratic candidate for the governor of the state of Indiana. And I am so grateful that he is here with us today. And I wanted to just give you a moment, Woody. After I saw your video on Tuesday, I thought it odd, and maybe it's just me being out of the loop, but I believe I came across an article just yesterday from Governor Holcomb addressing race like a big press conference. And I thought, wow, that seems uncanny that it just happened right after I saw your video talking about racism. And I just kind of wondered about that, if that was just kind of a coincidence or strategy.
Well, I don't know how to interpret his timing other than it's much too little and much too late. My opponent has been in office now for almost 4 years, and he decides to address the issues of racism and disparities for the first time in a significant way, 75 days before his reelection campaign. And so it's just the timing to me is awful. In the sense that it's perfectly well designed to confuse people into thinking that this is an issue that he truly cares about. If he really cared about it, he would have done something 3 or 4 years ago. We'd be now evaluating the success or the failures associated with his efforts. And his predecessor, his previous boss, Mike Pence, would have done that. He didn't do it. His boss, his predecessor, Mitch Daniels, would have done it, and Mitch didn't do it. So I just think we've had Republican governors now for almost 16 years, and here it is, 15 years and almost the 16th year anniversary, and now it's an issue. I just don't buy it as being either a coincidence or sincere. There's very little in the announcement yesterday that we can really trust and depend on. I mean, there's a new position that was announced, but we don't have any idea what the budget or power of the position will be. There were other changes that were suggested as well that will require appropriations, and of course the legislature doesn't meet till January, well after the election. Right. I just know that there are a lot of questions.
Right. Well, I thought it was interesting. I happened to catch it may have been a Facebook Live, maybe your show, on Wednesday. Was it Wednesdays with Woody? Is that what it is? But I was listening to your conversation, and you were talking about, let me get this straight. You were talking about the state of Indiana and its racist history, and you were citing the one of the probably the most famous or infamous, I guess would be the proper way of referring to it, photograph of racism, of a lynching that oftentimes is the photograph whenever the topic of lynching comes up. That is the two gentlemen that were lynched, and that was in Marion, Indiana.
Right. Marion, Indiana.
Right in front of the courthouse. What?
Yeah, that's right.
Yeah.
This was back almost exactly 90 minutes ago, or excuse me, 90 years ago. And that lynching seared in my mind because of the fact that about 10 to 15,000 people, presumably Hoosiers, showed up for it to picnic and pose for pictures. And anybody that doesn't believe it, just Google it. You'll see it for yourself. And it just is a very sad commentary that if you read the story about those two young men, they were accused of sexual assault on a Caucasian woman who later said that she made it up and it didn't happen. And all of those things just disgust me today. And it also disgusts me that the state of Indiana just won't address its past so that we can have a better future. And that's one of the reasons I decided to run, Bill. Either I could sit around and complain about it and write op-eds all day, or I can roll up my sleeves and give the voters a choice. And I decided to do the latter.
Well, I'm so glad that you are doing that and bringing attention to these kinds of issues that matter. That matter. You know, Black Lives Matter.
Absolutely.
The lives of Hoosiers matters. Our history matters, and our absence in addressing some of these things is sometimes appalling, for sure. So, I want to thank you for being here today. I know that you are again on a campaign schedule and trying to make the most of your time in virtual land and trying to meet and greet as best you can with gloves and mask on and everything else. Which you must be, at home with that, being a doctor, spending so much time with that material.
I know how to wear a mask and a gown and a glove, something I've done a lot, but you typically do it outside in public. But nonetheless, we're adapting, and as everybody's going to have to adapt, because this virus is going to be with us for years, and this will be part of the new normal. So let's get used to it. Let's put our mask on, and let's protect each other and ourselves. Bill, thank you for this opportunity. I really appreciate it.
Yeah, thank you so much for being with us today, Woody. And I want to wish you the very best on your campaign, and I hope that you that you need and that you're able to continue to push this message out there. And I know that I appreciate hearing it, and I'm sure that there are many fellow Hoosiers who also appreciate your attention to the areas that you are raising up and bringing attention to. So thank you.
Well, thank you.
Yes, sir.
Much appreciated, sir.
Oh, you are so very welcome. And so I am grateful to have you here with us. I know that you are going to be leaving us here in just a moment, because you've got to move on to the next stop. So again, I thank you for being with us today, and I wish you all the best, and I'll be talking with you soon.
I'd like that very much. Let's continue the conversation and continue the fight, because that's what we've got to do.
Absolutely, absolutely. So you have been listening to Dr. Woody Myers, Democratic candidate for the governor of the state of Indiana, and an esteemed medical doctor who has done his share in the medical community and the public health community, and we're grateful for all of his efforts. You've been listening to Bill Myers Inspires right here on the Inspired Choices Network. See you next week. Thank you.
Thank you for spending your afternoon right here with us at Bill Myers Inspires. Remember, we're here every Friday at 3 p.m. Eastern Standard Time on the Inspired Choices Network. Remember to take time this week to take a breath and look within yourself and figure out how you can make a positive difference in this world. Spread the word, and we'll see you here next Friday.